Hello everyone, in today's video we do some reflections on the epidural topic. We are going to see pros and cons about this procedure. We're going to see when you can have it, who can have it, so that whether if you are deciding right now if you want an epidural or not for your labor, or you have already decided that you want one for sure, you know exactly what to expect from this procedure. Let's go into the video now. Hello future or current parents, welcome back to this channel. If you're new here, if this is the first video that you watch, my name is Ilenia, I'm a midwife. I've been a midwife now for more than 7 years, and I've been helping women all over the world during their pregnancy, birth and postpartum journey. So if you like this type of content, if you are expecting, if you're planning to, just join the community and subscribe to the channel, because you can get a video about anything you like motherhood related every week. That being said, let's start with the video. Today's video is about epidurals. Now, I've done a video already on my channel about epidurals, so make sure to check that out. Why I'm doing another one? First of all, because that video is already a year old, so I always like to update things and to get a bit more into depth about some particular part of a topic. Plus, I was new on YouTube last year, so I am getting a little bit more confident about it, and I would like to expand the concept a little bit better. Also, I've been receiving some comments about, especially on epidurals, and I know pain and pain in labor is a topic that you really care about, obviously. No one likes to be in pain. And I've been receiving some comments regarding some discrepancy that you can find on my videos. Possibly I thought I was quite clear, but maybe I wasn't. And also on the literature, because no one is sure about when is the best time to get an epidural, when you should get it, why you should not, why you should, and blah blah blah. So this video is just my opinion. I'm giving you a bit of professionalism in this video from my practice experience, my 7 years assisting women during labor and birth. But again, it's your decision whether you want to have an epidural or not. It's completely your decision, and I want to see it here as a first landmark for this video before we go into depth. It's your decision, and you can make it once you have the knowledge to make a decision so important like an epidural. An epidural is a medical intervention that nature has not planned for you to have, so it's something external that we're giving you. Is it good? Yes. Does it mean that every woman needs to have one? No, it's completely up to you and to how you decide to manage your labor. But I want you to make an informed decision whether you decide to have it or not. I want you to know what is involved with an epidural, what can be the side effects, what can happen, what cannot, so that you can make an informed decision about it. It's key. So if you are not sure, or even if you want to have an epidural and you're sure already, please make sure that you have been educated about labor and birth, that you've taken antenatal classes, that you've done prenatal parenting classes, whatever you want to call it. Make sure that you've done that. If you want to do some with me, I'll put the link down below of my website. What is an epidural? An epidural is the most effective pharmacological pain relief available to us right now. It involves an insertion of a plastic tube through a needle. The needle then is removed. This plastic tube stays in a space called the epidural space, which is a little space located in the lumbar part. Like, it's everywhere, but like the epidural goes in the lumbar part because it's there are the nerves that we want to try to limit the pain signal transmission there. Anyway, the catheter will be put through the epidural space in your lumbar area, in the lower back basically, and through the catheter you will receive some medications, either through boluses or through a pump. It depends where you are, and therefore the feeling and the sensation of the contraction is considerably reduced. You still will be able to feel the contraction happening, the tightening in your tummy. You will definitely feel the pressure as the baby gets lower in your birth canal, so that you can feel the pushing and you can get the baby out when it's time. So it does help a lot. Like, it takes away a lot of the pain. Sometimes it works even too well and it can slow down the contractions, for example. And that will link to the main point of this video, which is like when you can have an epidural. Technically, the straight answer is any point. Can I have an epidural right now, me, as I'm talking to you in the video? Yes, I could. Like, the rationale is like why you're getting one. Obviously, we have so many women coming very distressed and very out of control already when they're not in active labor. Bear with me, active labor is such a very broad definition, but usually is when you're 3 to 4 centimeters with good contractions, meaning they're regular, they're long, they've been ready and steady with a pattern for a while, so we know that you're in active labor. That will be the best moment to get one. Does it mean that you cannot have it before? No. Does it mean that you cannot have it later? No, you can have it. Why we don't want you to have it too late? Because the baby is about to come out, so by the time the epidural is a procedure that takes a certain amount of time, so by the time maybe you do it, you won't even benefit from it and the baby will be out. So then we will suggest you to just keep going as you're doing, because if you've got to that point with no pain relief, like, I'm sure you'll be able to do it for a little bit longer if it's not too late. Sometimes, like, I've done epidurals even with women at 8-9 centimeters and it worked perfectly for them. So it could be something that it could be done for you. It depends from the situation and the context. Or can it be done too early? There is no contraindication. You could have it when you are 1 or 2 centimeters. Why we highly suggest you not to? The epidural can slow down the labor a bit and can slow down the contractions because you feel very relaxed. The nerves have like different signals going through and forth. The oxytocin production is alterated in a normal physiological labor with an epidural. Therefore, we don't want to take the chance to do an epidural into you and then you've been with the epidural for 3 days because maybe your early labor was just started and therefore you're going to be with that dilatation, with those contractions for 3 days. And that's not safe. That's not safe for you, for your baby. It will require such a high level of monitoring from the staff. No hospital is able to provide that to all the women. Therefore, we suggest you have it when you're in active labor. But there are some exceptions. There are a lot of exceptions. First of all, someone can be in active labor even when the cervix is not the famous 3-4 centimeters. That's just a number. It's very subjective. Therefore, it depends from you, from how long you've been contracting, for if it's your first baby, your second, third baby. It depends from so many things. And also it will depend if you have been induced or not, for example, because if you're having an induction, a lot of places should offer you an epidural even before you start the induction process. For induction process, I mean the water breaking part and the intravenous oxytocin. You could have an epidural before you start that. Or maybe there are some complications during pregnancy that will benefit from having an epidural. I'm talking about women, for example, with high blood pressure. There are so many things that you should be able to discuss with your doctor or midwife before you go into labor, so that you know where you are, you know where they are, and you know if you are a good candidate for having one, or if there is any contraindication for you to receive an epidural. Can it have some side effects? Yes, some are very minor, like your legs are gonna get a bit heavy, especially after the 20-30 minutes post the epidural. Then you should be able to stand up and walk around with the help of your midwife or your birth partner or both, so that you can get the baby in the position and help them to rotate. You can get some itchiness, nausea, vomiting. Those are all usually temporary. Your blood pressure might drop. You might need some IV fluids, which, some fluids through your vein, basically, which is not great if you're getting many liters of it. You can get some headache the days after, usually, and then like very rare, more complicated ones, you can get like nerve damage and the other things that are very rare, but your anesthetist will go through it to let you have a very informed and proper informed consent. It could require you having a urinary catheter, because you might not be able to feel the bladder getting full and empty, and therefore that can have a negative impact on your bladder well-being in general and to your baby descent in the pelvis. And also it could prolong labor, as I was saying, especially the second stage of labor, meaning the part of labor where you start to push your baby. Now, is it certain? No, there are so many studies against and so many others that says that the actual second stage is longer with an epidural. It's a battle that has been going on for decades, so we don't even know for sure. It does seem to be like that who has an epidural has a higher incidence of instrumental births, meaning with ventouse or forceps, but overall does not increase your chance of having a cesarean birth. And even for the instrumental part, it's still quite uncertain. There's some studies that said it does increase your chance of having instrumental, others that it doesn't. The epidural also requires you to be a little bit more closely monitored with your vitals. We need to check your blood pressure, your temperature, your pulse rate, your oxygen level. We need to make sure that epidural medication, the medication inside the epidural, doesn't go too high or too low. We need to check your baby, making sure that your baby is coping all right. There are so many things involved that you don't even realize, like we have to check your bladder care to make sure you're walking and you're moving, that you're changing position. You really need like a one-to-one midwife when you should have a one-to-one midwife when you have an epidural, because it's so important for your safety. So also bear in mind that some hospitals don't even have enough staff for that. You might develop a fever, which can be linked with an epidural, or also can be linked with you having an infection. So it's quite hard to distinguish whether you're having an infection of the membranes, a chorioamnionitis also called, or if it's just a raise of blood pressure temperature because of the epidural. So again, it's just a first of series of intervention that you might need. Sometimes you don't. Some women have an epidural with no complication whatsoever, and they just go on and have their normal beautiful birth. Some women instead require more medical intervention because they had an epidural. Does it mean that you cannot have it because of all of this? No, you can decide when you can have an epidural. Discuss with your midwife. I feel so sorry when I hear stories about people not receiving an epidural when they wanted one. And if you feel there is resistance from your midwife, from your doctor, of you getting one, always ask why. We work with you. We work with you, mama and couple, to let you have the birth that you want. So it shouldn't be that you're not allowed to have an epidural because someone else says so. Obviously, unless there is any medical complication, something that is going on, you should be able to get one. Unless the anesthetist is busy, unless there are not enough anesthetists in the hospital in that moment. But generally speaking, you might need to wait a bit. That's why it's so important that you're prepared, even with other coping techniques, by the time you get your epidural. But overall, you should be able to get it. So please make sure that your voices are heard. Do complain if you're not listened to, because it's your right. Your birth story matters. I feel very, very sorry when I hear some stories of women saying that she couldn't get an epidural because the staff wasn't allowing her to. I'm always like wondering what is the reason, really, the real reason behind that, because the birth team should work with you mamas. It should not work against you. So unless there is any contraindication in particular, you should be getting what you're asking for. I hope that was a little bit clearer now, because again, you can do whatever you want. Like, it's your body, it's your choice. Listen to the midwife and the doctors, but you can still make your own decision once they don't seem rational to you, obviously. Or if there is something going on that you don't understand, please do ask them to explain to you again, because you need to know what's going on and what has been done to you and to your baby, always in labor, regardless of the epidural topic or not. I'll see you next video. Don't forget to subscribe to the channel, and bye bye.